Good afternoon. Whoops. Welcome. I know that some of you have been here all weekend long. It's great to see you back. It's great to see how many people have been interested enough in this topic to commit most or all of their weekend to this. And for those who are joining us today for the first time, welcome. My name is Philip Sneed. I'm Executive Director here at the Arvada Center for the Arts and Humanities. And we're here, of course, to commemorate the 25th anniversary of the FBI EPA raid on the Department of Energy and Rockwell International at Rocky Flats, June 6th, 1989. We've had a very interesting weekend so far of panels and presentations of both visual and performing arts. I'm not going to speak long, but I did want to just draw your attention, if you have not already seen it, to the exhibition, which is downstairs in our History Museum. It will be running most of the summer, so you'll have another chance. But while you're here, I hope you take a chance to look at it. We have an hour-long break between this panel and the afternoon panel. And that brings me to the Rocky Flats Institute and Museum, which has been responsible for that exhibit, and they're one of our partners in this. And I just want to take a moment to say that this is a very worthy institution that's in trouble and needs your help. And we risk losing this museum and this valuable resource, this valuable repository of the art and artifacts from Rocky Flats. So they have a table upstairs. Please do what you can to help them. I would also like to thank our primary sponsor, which is the Bulletin of the Atomic Scientists and John and Carol Balcom. The Bulletin has a table out there. They're fascinating. They've been hugely important, going all the way back to the Manhattan Project, and we couldn't be more pleased to have them as our primary sponsors. This event would not have been possible without them, so our thanks to them. I would also like to thank our partners, the Rocky Flats Institute and Museum, as I mentioned, and the Center of the American West at CU Boulder, and also give a great deal of credit to the Carnegie Library's Maria Rogers Oral History Program in Boulder. We also enjoyed advice and support from History Colorado and Colorado Humanities. And of course, the Arvada Center for the Arts and Humanities enjoys very generous support from the City of Arvada and from the citizens of the Scientific and Cultural Facilities District, the SCFD. And lastly, I would like to thank the staff of the Arvada Center, which has done an extraordinary job taking this on in addition to all of their regular duties, and I appreciate that. And my thanks to all the panelists and artists and all of the institutions represented here. Many, many people have contributed their time and talent and travel to this project, and we appreciate it. So, with that, I will now turn this panel over to our moderator, Laura Frank, Vice President of News for Rocky Mountain PBS and Executive Director of iNews. Laura?
Thanks very much. Thank you, everyone, for coming. I do want to let you know that we're going to be talking about worker health, but this will become an interactive panel. So there will be time, a significant amount of time, before the panel is over for some questions and answers. So if anything that you're hearing here sparks an interest, or if you've come with something that you want to talk about, then be ready for that. We will definitely have time at the end of the panel to get to those questions and answers. Just a little bit briefly about why I think I was invited to come here. I spent a significant portion of my journalism career covering Rocky Flats and the other nuclear weapons facilities around the country, and what an amazing system and set of people involved in that. And I'm looking out in the audience and I see some faces that I recognize, so it's good to see you. Thank you for being here. I will let the panelists introduce themselves and tell you a little bit about their connection to Rocky Flats. So, Lee, do you want to start?
Sure. Hi, everyone. Good afternoon. I'm Dr. Lee Newman. I'm a professor at the Colorado School of Public Health and a physician. I practice pulmonary medicine and occupational medicine, and first became involved in addressing the health of workers at Rocky Flats starting in the mid-1980s.
Hi, I'm Terrie Barrie, and I'm a wife of a sick worker from Rocky Flats. I began my advocacy on his behalf 19 years ago, fighting for justice for him to be compensated for his illnesses. What I saw through, actually from some of Laura Frank's earlier articles in the Tennessean, was that some of his diseases were common across the country. And over the 20 years, we have developed a wonderful advocacy groups from advocates from across the country. And we continue to fight for justice for these workers.
Indeed, indeed. So if you've been here for any of the previous sessions, you're probably pretty steeped in the history of it. We're here commemorating the anniversary of the raid on Rocky Flats in 1989. And you'll recall that the site opened in 1952, and the cleanup began in 1995 and went on for a decade. Before the cleanup was over, Bill Richardson, who was the energy secretary in the 2000s, reversed a policy that had been the federal government's official policy around health questions, not only at Rocky Flats, but all of its nuclear weapons facilities across the country. And that policy had been, if someone brought up an issue of health, that their health had been harmed during work at one of these facilities, the reaction of the federal government was to fight that person in court. That was reversed in February of 2000 when then Energy Secretary Bill Richardson said publicly that actually the government was now going to recognize that there had been harm to worker health. And out of that, the next year, Congress enacted what we fondly call EOICPA, because acronyms have to have a way to say them, right? And that's the Energy Employees Occupational Illness Compensation Program Act. And I know you both have quite a bit of history with that program. Terrie, maybe you could start us off just with a little before and after, because I know George tried to bring a workers' compensation claim before EOICPA. What happened? What was the reaction of the government? What did they say about his health then?
Okay, and this is from like 1996. You know, Rockwell International denied. George has a variety of diseases. Fortunately, they're not cancerous, but they're definitely debilitating, and it's very difficult for him to have a normal life. He had an incident report that showed that he ingested plutonium, and we thought this is all we need. We've got some medical documentation supporting his diseases and how it was associated with his ingestion. The Department of Energy and Rockwell International fought the case. And from what I understand from Department of Energy workers, that they spent over $50,000 fighting this case. So when then Secretary Richardson made this announcement, we were thrilled. They're finally going to take care of my husband. He's going to get what he deserves, not the millions of dollars that people think, but the medical care and his the difference between what he gets in Social Security and what he would have won in workers' comp. And the medical care is like the number one big issue. I mean, if you have ever had an unexpected disease and didn't have insurance, trust me, those your finances are in grave jeopardy. So he filed for EOICPA in 2001, thinking that, you know, and we had Department of Energy officials come up to us and tell George, this law was made for you, and I can name names. He has not been compensated for all of his diseases. There's only one small disease that he's been compensated for. He has been fighting for justice, and I have been fighting for justice for him, for this law that was written for him since 2001, so 13 years.
Dr. Newman, the work that you do started out focusing on beryllium, which is one of the, I think you described it as, go ahead and tell us what the fingerprint.
Right. Well, it's in some ways things were able to get rolling in terms of recognizing that there was an issue with worker health at Rocky Flats because we had a real fingerprint on Rocky Flats with this disease. Chronic beryllium disease is a scarring lung disease in which the immune system reacts to the metal beryllium. And there's a test that can be done that identifies that reaction in the body. So it was really incontrovertible that people were being exposed to beryllium at Rocky Flats and developing a disease that we could measure in their bodies that we could directly attribute to the beryllium metal.
So one of the things that has struck me over the years is when you have what appears to be incontrovertible, and yet there have been difficulties in identifying this disease, and we'll get into that in a moment. But let's stay on the things that Terrie was raising first. Why, Dr. Newman, do you think it's so difficult to draw a connection between exposures and disease? This has really been, in many ways, the holy grail of the post-operation era of these nuclear weapons facilities, trying to determine what is the connection between exposure and health. Why is it such a difficult thing to do?
Well, it's difficult because of a couple of reasons. One, the kinds of illnesses that we're trying to identify and establish connection between an exposure and an illness, there's a gap of years. It takes many years from when someone's first exposed to a toxic agent, whether it's plutonium or beryllium, cadmium, chromium. You can go down the whole periodic table and then more. The number of years between when you're first exposed and when the body develops the disease and when doctors can diagnose, can actually recognize the disease and make a correct diagnosis, if they ever do, can span decades. So, if somebody has an unfortunate accident, like, your hand gets run through a saw and you lose some fingers, that's pretty clear. The more acute it is, the more obvious it is that connects the exposure to the saw blade and to your hand, the more direct the answer that connects the two. But when you have a gap of decades, that's really a challenge. I'll add one other challenge, which is that sometimes the conditions that people develop could have been caused by something other than the exposure, right? So we're always trying to decide, well, what was the most important exposure? And one of the classic cases of this is that we know lung cancer can be caused by asbestos exposure, but we also know that lung cancer can be caused by tobacco smoking. And in a person who had exposure to asbestos and smoked, multiply that effect in terms of their lung cancer risk. But it can be difficult to say, well, was it the smoking that did it? Was it the asbestos? Was it both? So these are the kinds of challenges when you have a disease which has other causes, and you're trying to figure out how to attribute it to the right exposure.
If I could add something, one of the great things about how the law was written for under Part E, this is a complicated program. Under Part E, the criteria is that the exposure was a significant factor in contributing to, aggravating, or causing the disease. So if the worker was smoking in a plutonium area, technically the plutonium would have contributed to, as far as I'm concerned, and I'm not a physician, would have contributed to the disease.
This is something, the additive effect, the synergistic effect, both of you have dealt with this to some degree in the work that you're doing. One of the things we'd like to talk about today is not only what do we know about worker health, but also what don't we know? And it seems to me that the synergistic effects are something that fall into that latter category. Do we know more than we used to about it?
You want to talk specifically about the synergistic effects, or?
Yes.
We may know a little more, but not a lot more, as it applies to the workers from Rocky Flats. Looking at those combined effects, there hasn't been a lot of research done that I know of to really examine that. And I don't even think today that it would be particularly easy to get our hands on the data that would be necessary to answer the question about synergistic effects or combined effects.
Terrie, you've spent a lot of time looking at the data, the health data, the exposure data that are available from Rocky Flats. Tell us a little bit about the condition of that information and what we can and can't figure out from it.
From what the workers have told me and the lack of documents online, Rockwell and Dow and Rocky Flats in general did not monitor for the majority of the toxic substances that was present, unless there was, of course, a major spill or something like that. They focused on the radioactive materials in the later years, mid-'80s, I think you said. They started looking at the beryllium exposures, and I think there was one other exposure they looked at, asbestos. But, you know, these workers were exposed to carbon tetrachloride, trichloroethylene, heavy metals. There was no monitoring for that. So it becomes difficult for, you know, the scientists, I imagine, and personal physicians to say, okay, here's the documented in this room on this date, lead was present, because Department of Energy did not monitor for those exposures. And so what we have here, if I could use an example, one of the things that the Department of Labor requires is for a personal physician to tie an exposure to the condition. So we're going to use an example of my husband, who was a machinist, and he machined uranium. And at Rocky Flats, I have a document that says that the uranium had cadmium in it. So he machined uranium-cadmium alloy. And after that machining was done, he cleaned that part with trichloroethylene. So I have here from the NIOSH Pocket Guide, that's the National Institute for Occupational Safety and Health. And this gives you target organs of those three chemicals. So cadmium, the target organ is the kidney. Uranium, target organ is the kidney. And trichloroethylene, target organ is the kidney. So you take this to the Department of Labor, and they want which one of those chemicals cause the kidney disease. A doctor cannot confirm or assert, well, it was only the trichloroethylene, or it was only the cadmium, or it was only the uranium. It was probably all three contributed to it. So, but a doctor is especially a personal physician who is not an occupational medical doctor, they have a lot of difficulty fulfilling the evidential requirements that the Department of Labor places on them.
Did you want to add to that?
Yeah, I'd be happy to. I think that we have a couple of significant issues that you've raised. One of them is you put people into a system which has a set of rules where the rules don't apply to everyone. You know, we'd like to have rules that we can apply to everyone, but how many of us are exceptions to the rule? I'd say probably in one way or another. When you look at EOCPA just as one set of rules that we put in place that's trying to cover everyone, we're going to find a lot of exceptions that reasonable physicians and reasonable industrial hygienists probably would agree should be treated as exceptions, and those people should be compensated and treated. But here's where it gets challenging. From where I sit, the point you made about primary care physicians and what they know and what they can do with this is really true. We unfortunately do not train our medical practitioners in this country very well around identifying work-related injuries and illnesses of any kind. And it's not particular to Rocky Flats. Just in general, I can tell you as a professor who teaches occupational medicine doctors to become occupational medicine doctors, there are very few of them in the country. And as far as trying to educate general practitioners, family practice doctors, primary care physicians, internists, even specialists, they get very little contact with those of us who understand how the body is affected by the work that you all do. And so they're put in this spot of being, frankly, for the most part, undereducated, and then required to make some kind of a judgment around something that they really don't have a lot of knowledge about. So it's definitely one of the difficulties that we've faced with this.
And one of the things that I would like, and I think every former worker would appreciate this, one of my dreams, and I don't know if you would ever agree with this, I would like to expand the screening program, the medical screening program. I know there's issues involved with that. I think most of it is financial. But I think all of the workers across the country deserve a Mayo Clinic type of facility or program where doctors like Dr. Newman can not only evaluate but diagnose and provide a treatment plan to take back to the personal physician to help these workers.
That has come up multiple times over the years. Dr. Newman, what's your reaction to that kind of idea? You've worked in several different systems that might be related. What?
Sure. Well, I think what Terrie suggested is absolutely the ideal. If you don't have enough experts in any given area, such as the health of Rocky Flats workers and its relationship to their job, then an ideal would be, and I would say this for any of the sites around the country, would be for there to be a place or places or centers of excellence to go to get that kind of care. So that was in fact something which for many years we worked to develop when I was at National Jewish for many years. So just sort of going back in time, and this is as good as an example as any. 1985, I saw my first Rocky Flats worker. He came into my clinic with a diagnosis of a rare disease called sarcoidosis. That's what he had been told he had. Those are air quotes. He had been told he had that diagnosis. And I don't know if I was the first, but I was among the first to ask him the simple question, what do you do for a living? And he said, I work at Rocky Flats. To which I said, what's Rocky Flats? I had just moved to Colorado the year before, and I had no idea that 17 miles from where I was at National Jewish, that Rocky Flats was there, let alone what they did. Of course, then I tried to find out what it was that he was exposed to, and then he shut down. He basically said, well, I can't tell you that. Going, well, this is making it really difficult for me to take your medical history and determine if there's a relationship between things you're exposed to and this disease that you've been told you have. I finally convinced him that I would just ask him the names of metals that I knew could imitate the disease that he was told he had. And I started from the A's, and when I got to beryllium, he stopped. He said, well, and I know he was sort of hesitant because he wasn't sure if he was violating some law, but he said, well, I'm a beryllium machinist at Rocky Flats. That was actually the opening moment in terms of understanding that we had a problem on our hands. Fast forward, I was able to use an immunologic test that I was working on in my laboratory at National Jewish to test his blood for whether he had an immune reaction to beryllium. And his entire life, Willie never forgave me for drawing a syringe about this big, or so he thought, a syringe this big of his blood, testing it, but it proved that he had beryllium disease. And at that point, we had really opened Pandora's box, because then it was on my shoulders and my partner Kay Kreis's shoulders to go back to Rocky Flats and say to the medical department, I think we may have a problem. If you have one person with this, you may have others. So from that point, we decided what we needed to do was to set up a clinic where we could become really expert in this, starting from not even knowing what Rocky Flats was, having to accelerate our acquisition of knowledge just so that we could become a center where people could come and get a diagnosis or not. If the people had it, great. We could figure it out from there and figure out how to treat you, and at least you had confidence that you had that condition, and we could figure out what to do from there. Or maybe you didn't have it, but at least you would have a center of excellence where that kind of care could be delivered. And there have been a few other centers around the country that have imitated that model and been successful with that to address some of the needs of workers in different communities. But there are not that many.
Right, and they're basically limited to chronic beryllium disease, correct, or lung disease?
They're mostly focused on the lung
Yeah.
diseases. I think that's fair to say.
Right. There's a lot of common diseases that, from the workers I've spoken to, they suffer from peripheral neuropathy, toxic encephalopathy, chronic fatigue, fibromyalgia, gastrointestinal musculoskeletal. It's those type of diseases. Actually, these workers just need to be taken care of, medically.
Following up on what Terrie just said, is there any reason to believe, I know you have given us a little bit of the evolution of how really you identified this as a problem for those workers. I know you have a similar story, and we'd like to hear it in a moment, about plutonium and the evolution of discovering the relationship between plutonium and lung disease. Is there any reason to think that there aren't other relationships that have not been solidly identified in this way? In other words, when I hear Terrie talking about the folks that she's worked with nationwide, and I hear your story of how we have come to understand two of the most understood exposure disease relationships, it makes me wonder if there are others out there that we have not nailed down yet, and are there people suffering because of that?
I'm gonna give you the kind of answer that you really hate. I'm gonna say maybe. And I'll tell you why. I'm a scientist, I'm a researcher, I'm a physician. I try to go with what's the evidence. Mm-hmm. And there are two kinds of mistakes we can make. We can either overcall it and say any particular health condition was caused by an exposure, or we can undercall it and say, because there are other causes, we're not going to blame it on Rocky Flats. And you can make errors in both directions. And there probably are people who receive compensation, potentially, who did not have a work-related health problem but compensated anyway. And then we have a lot of people who do have a work-related condition who have not been compensated. So we have a situation where both of those kinds of things can happen. And it's because we don't really have enough of the data to really know. We have not defined all of the health conditions probably that are related to work at Rocky Flats. And in some cases, we probably never will because there are too many other causes of those conditions as well.
I'm going to give a few of, did you want to follow up on that, Terrie?
I was just going to mention your work for Econometrica, that report, which was excellent. You did identify, and like you said, backstage, the easier ones. Yeah. But I do remember, if I correctly, that you did mention peripheral neuropathy and kidney disease, I believe, in that. It's been a while since I've taken a look at that. It would be ideal if Department of Labor actually used that well-rationalized report that you did to adjudicate the claims correctly. I mean, you put down, and your staff, they put down, if the exposure happened 10 years ago and the latency period of the development of the disease happened within this time period, then it's probably due to the exposure to these toxic substances. I thought it was great. I really did. And it's unfortunate that Department of Labor does not utilize that.
Yeah, for people who don't know this little piece of history, because I think, Terrie, you didn't even know my connection to this until
Right, yes.
we were at a meeting last November. But when EOCPA was created, they needed to have some criteria for deciding for their claims examiners to be able to decide who do we compensate and who don't we compensate. And through a contractor called Econometrica, my group at National Jewish was contracted to come up with the first set of criteria. And I brought in occupational medicine doctors and toxicologists and experts in workers' compensation and pulmonary specialists. We had a team that really drilled in and came up with these criteria, some of which I know are being used, many of which are probably now gone through different degrees of modification as they've been used. But frankly, we never finished the job. We got to a point in the contract where we had done probably, like I said to Terrie backstage, some of the easier ones. It's pretty easy to set some criteria for beryllium disease, asbestosis, silicosis, some of these conditions. But when you get to some of the more challenging ones like kidney disease, where there are lots of potential causes, it's complicated by if people have diabetes or hypertension or other things that also damage the kidney, plus they were exposed to cadmium or uranium. When you try to figure those out and set a set of logical rules, it gets more challenging. It was at that point that, for whatever reason, the contract ended and it was not renewed for us to finish that job.
And that's unfortunate.
And so, frankly, the claims examiners were given the tools to work with for the more straightforward and, frankly, the more common work-related conditions. That's what we gave them. And then the really tough ones, where even the best doctors and toxicologists can reasonably disagree with each other, but where you don't probably want it in the hands of a claims examiner to try to figure out complicated exposure and medical information, they were left having to do exactly that.
Right.
So one of the things that evolved from that situation is something called the site exposure matrix. And for those of you who are former workers or have a connection to former workers, you have a deep understanding of the complicated kinds of exposures that workers face. For those of you who didn't, these were some of the largest and most complicated situations of manufacturing and development in the world. And there were multiple toxic substances in addition to radiation that these workers were working with on a daily basis and working under a great deal, let's remember, a great deal of pressure. The stakes were high. The Cold War was raging. There was very serious secrecy. And so people had a little bit of knowledge about, well, I guess I should say a lot of knowledge about their particular thing and really not any knowledge about other things that were going on maybe right next to them. So there wasn't a lot of back and forth communication about it. What has resulted in this UICBA, I wanted to give a few statistics about how this compensation for workers' health program has evolved. There have been more than 250,000 claims, workers coming forward or their survivors coming forward saying our health was harmed during these processes. Of those, a little over 250,000, I think it was 257,000, just under 100,000 have been paid. So about 94,000, which if you can do some quick math is about a third. For Rocky Flats specifically, it's just under 9,000 claims, and this is coming from the latest data that the Department of Labor has released. The Department of Labor oversees that program. Of those 8,800 claims, about 2,600 have been paid, and that's a little bit less than a third, about 30% of the claims have been paid. So this site exposure matrix was developed, and Terrie, what was the idea behind that?
Okay, this, and I'm not sure, I'm not going to, this, we thought it was our original idea, but after meeting Dr. Newman last year, I'm not sure, but the advocates back in 2005, I believe it was, approached Department of Labor and said, you need a database that would link the job category to the building, to the toxic substance, to the disease. And if it matches up, then the worker gets paid. We envisioned that this would, and of course it would be documented, with the scientific research papers. It's not, just pulled out of the air. And that was our envision, to simplify the process, because the workers and the workplace was not monitored, and that is very important. It has to be an educated guess that a machinist who worked with carbon tetrachloride developed this disease, and expanding on the latency period of Dr. Newman's paper, then it's likely that at least the carbon tetrachloride contributed to the disease. The law says it doesn't have to be caused by it, and this is where I think the Department of Labor doesn't quite get the legislation, it only needs to contribute to it. And we have, I pulled this off the site exposure matrix. This is, excuse me, a copy of every toxic substance that was present at Rocky Flats. It is 15 pages long, and if you can see the fine print on here, not all of these were monitored, but a lot of them have a lot of very bad health effects. You know, I'm just mentioning the ones that are more common knowledge, but there was like Crizine. I have no idea what Crizine was, but it was there at Rocky Flats, and somebody somewhere worked with it. Same with carbon disulfide. Health effects. Did it contribute to any of these diseases? And I'm going to say, yes, it did, somehow, somewhere, for someone.
I haven't memorized the list, and I don't know all the health effects of everything on the list, but I'm just going to jump in because carbon disulfide is an example. It reminds me of a story. It's one of the known causes of Parkinson's. It's strongly connected. OSHA, the Occupational Safety and Health Administration, considers it one of the most clearly connected to Parkinson's disease. And I remember writing a story about 5 years ago about a woman from Ohio who developed Parkinson's disease when she was in her early 30s, and she'd worked at the Mound plant and worked with carbon disulfide. And when she made her claim, she got paperwork back saying that nothing at that site had been connected to Parkinson's, despite the fact that carbon disulfide was common at that site, as it was at Rocky Flats, and that there are very strong connectors. So how is it, Terrie, that known scientific connections like that are not winding up in this database, which is supposed to, you know, kind of pick the low-hanging fruit, go out and collect all of those known scientific connections, put them in a database, so if I'm working at the Department of Labor, I can type it in and say, Parkinson's disease, carbon disulfide, there it is, send the claim forward to be adjudicated.
Okay, the site exposure matrix was contracted out to Paragon Industries, and they were intended to collect information from the sites. I think some of you may have been interviewed a few years ago, or probably close to 10 years ago, about what you worked with. The health effects part of the SEM is the responsibility of one person, Dr. J. Brown. He decides based on his criteria. I'm not saying his criteria is wrong or an error, but he doesn't recognize some of the scientific studies that OSHA does or that NIOSH does. He uses it's an ABC, and I'm sorry I wasn't prepared for this one. But he is the only one who decides the health effects that goes into SEM. His work or his decisions are not peer reviewed by, as far as I know, he has not contacted you for your advice, by any other occupational physician, toxicologist, health physicist. Only one person makes the decision. And one of the things that the advocates have been asking for, and so has the Institute of Health, or Institute of Medicine rather, and the General Accountability Office, is to have SEM reviewed by a peer group. And we're still waiting for that to happen.
SEM is the site exposure matrix.
Yes, I'm sorry.
So there's I think a really unfortunate disconnect that's occurred around this, and there are lots of disconnects, frankly. But one of them is that there were those of us who were starting to look at essentially creating these exposure matrices. Mm-hmm. You know, what kind of job did someone do? What were the likely exposures in that job? What were the potential health consequences of that? There were those of us who were working on those going back to maybe as early as the 70s, definitely by the 80s. And a professor at CU, the late Dr. Jim Ruttenberg, was one of those people who worked specifically on this kind of a matrix for Rocky Flats when I first got to know him in the early to mid 80s. So going back way before this effort that came up under IOCPA in 2005, going back almost 20 years earlier, there had been those of us who were trying to reconstruct what kinds of exposures had occurred and what kinds of exposures were occurring even in real time. I do want to add that there also were people who were working at Rocky Flats in environmental health and safety who were collecting data. They were hanging pumps to measure airborne exposures. They were checking area monitors, not for everything on this list, but for many things that are on the list. So there was exposure information being gathered, but this was used to create the screening programs, and we'll talk about that, I'm sure, to create screening programs for identifying whether those of you who worked at Rocky Flats would ever develop certain health conditions. When IOCPA, Department of Labor, started working on this particular set, this matrix that you were talking about, Terrie, initially, I remember this pretty well, there was not an initial attempt to connect what scientists and occupational medicine doctors have been doing for nearly 20 years around the various sites to actually connect those two together. So I can remember when we started having meetings where we'd have people from Department of Labor and Department of Energy meeting with people like me who are the researchers trying to understand this, and started asking critical questions like, well, can't we share with you the information that we've got and have that be integrated into this? How are you actually coming up with the information that you've got in here? There were a lot of challenges and a lot of disconnects.
What was your sense, Dr. Newman, for why?
Boy, that's a really tough one. But I guess that's why you're a journalist, right?
Just here to ask the questions.
Yeah, I could make some guesses as to why.
Go ahead.
I think that okay. People can become territorial. They decide that you're in Department of Labor. You decide it's your job. It's not their job. We don't have official lines of communication between our group and your group, so we're not going to rely on you. And and there's a lot of that goes on. A lot of kinds of unfortunate barriers that are created that I think are bureaucratic more than anything. And even today, I'll go out on the limb and say I do not think that the lines of communication between the Department of Labor and the Department of Energy around these issues is really what it should be around the health effects for workers. It's still, to my way of thinking, not where it should be.
How could it be improved?
Require everyone to play well together, to share the information they've got. So we have a screening program where we've now screened since 2005. We have a program that has screened nearly 2,100 former Rocky Flats workers, over 15,000 workers nationwide, but 2,100. We identified about nearly a third of those as having a potentially work-related condition for which they should apply to IOCPA. And then we get no information back. We don't learn back from the Department of Labor what happened to those specific people who came to us for screening exams, went through the process of getting further medical tests, eventually got either accepted as their claim accepted or declined. We don't have any route to get that information back from the Department of Labor back into our hands. So here I have the Department of Energy funding a free screening program for all of you, and then we hand it off to your physicians and the Department of Labor, and then there's no feedback message. So we can't really tell you today exactly how many people have developed what conditions that are due to working at Rocky Flats. There's a major, major gap.
And if we had that kind of information, what difference would it make?
Well, I think you asked earlier about, how could we learn more? How could we identify if there are other health conditions, for example, or if there are exposures that, if you look at them in a combined way, might be causing conditions that we haven't yet made those connections for? You only do that by getting a complete data set. If you can't get the information back, you don't know what you don't know. So it really is, until you have the data, you can't answer the questions that Terrie really wants answers to. She wants to know, is peripheral neuropathy being caused by exposures X, Y, and Z, or not in Rocky Flats workers? And to get that complete story, you need a more complete set of the records for those people.
Tell us a little bit more about the screening program. We started down that road. Let's pick up there again.
Sure, no, I'd be happy to. So the Department of Energy funds screening for former workers. And this program, which I've been involved in since 2005, there are actually several different programs around the country. So one is the National Supplemental Screening Program, NSSP, which I'm part of, and it's run by Oak Ridge Associated Universities. They have an office here in Arvada. That's one of them to test workers from anywhere in the country. There's also a program for construction trades. So if you were in construction trades and you worked at Rocky Flats or one of the other sites, Hanford, Los Alamos, et cetera, then you qualify to go through a program run by CPWR, the Center for Protection of Workers' Rights. And that's another national program, very high quality program as well. There's another program that's run from Queens College and Mount Sinai in New York, PACE. Is involved in that. So there are those three major programs. And then around the country, the Department of Energy also funds some individual smaller programs. So like there's one run out of the University of Iowa for people who worked in Ames at a munitions plant there. So there'll be some specific site-related screening programs. These programs are designed to offer exams for free to former workers based on your self-reported exposures. We basically, on the phone, have people who collect information on where did you work, when did you work there, what kinds of exposures do you know you had. We connected up with what we know was being used at those sites at that time, and then recommend a set of exams that are done for free. The information from those exams then is brought back to people who are really experts in how to interpret that information to figure out, is it likely to be related to having worked at Rocky Flats or not? And so this is to get around that issue of, how do you find a doctor within 35 miles of someone's home in rural Montana, and they were a former Rocky Flats worker. How do you find a doctor for them who's going to know enough about Rocky Flats? Well, we don't assume that they do. We ask them to collect certain information. They do the lab tests, they do the x-rays, they examine the person. They send that information back here to Denver, where it's reviewed by my team of experts. So we have doctors at National Jewish and the University of Colorado who review that information. It's then reviewed also by the group here in Arvada. And then we send out a letter to the participants, letting them know what we found that is actionable, either for their personal health, might be things that we think might be unrelated to working at Rocky Flats, to go see your doctor about, and also the things that we think are likely to be work-related, and make recommendations about where to go with that, as well as whether they should apply to EOCPA. So that's the structure in a nutshell of that program. And as I mentioned, we've now screened about 2,100 from Rocky Flats just since 2005. We would screen more if we had more funding, but we're always, like everyone, we're relying on what the federal government allocates for these programs. But we get in as many exams as we possibly can.
And you're focusing mostly, again, on lung?
No,
that's the
That's
information?
a great question. No, there's actually a list of about, I'm going to get this wrong, but ballpark about 25 different conditions that we're looking for. and only a few of them are lung diseases. So we have on there, we're screening people for hearing loss, which frankly is the most common. Noise-induced hearing loss is probably the most common cause of work-related illness that we see. It's nearly half of the people that we've screened. And we can separate the hearing loss of old age from hearing loss that's due to noise. So we're screening for hearing loss, we're screening for kidney disease, liver disease, lung disease, cancers. There's quite a list.
You were gracious enough to provide us with brochures. Is the list of diseases you screen for on that brochure?
Oh, I don't know if it's on there, but they're on our website.
Okay.
And I'll mention one other thing, which is important, is that we don't just come up with these. So you take, probably in the country, I would say that there are probably 30 to 40 scientists and doctors like me who have been thinking about and working on this problem at one or the other sites around the country. They may have worked around Rocky Flats or Nevada Test Site, et cetera. And we all come together. The Department of Energy brings us together twice a year, and we all review, well, what have we learned from the screening that we've done? And we look at that list of medical conditions that we're examining people for. We look at the exposure list, and we make sure that we're on track together to take basically the best medical evidence from this group of knowledgeable scientists and doctors and try to make sure we're doing the best by the workers. And we've got labor involved in that. We've got scientists from probably a dozen or more universities involved in that, and that's all with the goal of being able to offer a systematic approach to helping to identify health conditions in folks who worked at these sites. I'll add, it's not intended as research. It is a service program. Its main job is to identify former workers who have one or more health condition and get them into appropriate care and compensation.
That's great. I didn't realize that the diseases have been expanded. My husband went there, 10 years ago, and I think it was just strictly for the lung and CBD.
Yeah, and also I'll add that now we're starting to offer CAT scans as well. I don't know if you followed this, but for people who are smokers, but who also had exposures to various kinds of toxic chemicals and dust that can cause lung disease, lung cancer specifically. We're now doing lung cancer screening with low-dose CAT scans. So even over time, as our screening tools have changed, we're modifying the program to try to take advantage of the best tools available.
And when you do discover a disease that your experts relate to the exposure, does the screening program send a letter to the Department of Labor?
Not directly. So the letter goes to the participant. So this is medical information going back to the individual worker with a set of recommendations. And those recommendations are to see your if your blood pressure is high, it's to see your doctor for your high blood pressure, that kind of thing. But it's also got you have evidence on your X-ray that's consistent with asbestosis. And you should be seeing someone who had an occupational medicine or pulmonary doctor who's knowledgeable about that, and we recommend that you file with the EOCPA. So it has that kind of information. The screening program is not funded to provide medical treatment and diagnostics. So our job is to screen far enough to say, you know what, there's something here or there's not, and then it has to be handed back off to the rest of the medical system to then take care of those conditions.
Okay.
So the screening started full scale the same year as the raid on Rocky Flats. We like everything to come back to that. What has been learned in those years? Now, I realize that's a very big question, but what are some of the most important things?
So, I'll tell you some things that are qualitative and also quantitative. And I'll just start by saying one of the things that I hate doing is quoting statistics, because I'm a human being, you're each human beings, and we should not be treated as statistics. So I'll say that, but then I'm going to use some numbers. But as somebody who treated Rocky Flats workers one by one in my own clinic at National Jewish for 20 years, I see faces, I see names, I see people behind each of these statistics. So what do we know? We know, and the numbers are not firm, because I told you there are gaps in terms of adding up how many people have different conditions. But one of the things we know for Rocky Flats, let's start with beryllium disease. We know that all comers among people who worked at Rocky Flats, on average, about 2.5% of the people who ever worked there, 2.5% got chronic beryllium disease. In certain jobs, such as being a machinist, beryllium machinist, those rates were 10%, a 1 in 10 chance of getting an incurable lung disease. We know that there is a fairly high rate of asbestosis, which is a scarring of the lungs caused by asbestos, again, an incurable condition. We know that there are some people, especially at the higher levels of exposure to plutonium, who develop scarring of their lungs from plutonium. There are excess rates of certain kinds of cancers, and Terrie's probably more knowledgeable about the cancers on that list than I am. So qualitatively, just sort of ballpark, we can tell you that there are these 2 or 3 or 4 major lung conditions that definitely were caused by working at Rocky Flats, and then additional conditions, including certain forms of cancer that were caused there as well. A large degree of hearing loss for people who worked on the site due to noise exposure as well. So that's just sort of a sketch of some of the more common ones without me reciting numbers.
I'm a journalist, I love numbers, so you just feel very free to go ahead and recite those numbers to us. They really are staggering in many ways, the numbers of people involved and affected.
Well, I have to tell you just a really particularly distressing story. Back in the early days, anytime that I diagnosed somebody with a work-related condition at Rocky Flats, I knew what was coming next. I would write my report, and it would give my diagnosis and why I thought that this was work-related. And I knew what was coming next. What was coming next was a subpoena. I would be subpoenaed to testify in a workers' comp case. And workers' compensation attorneys would send the records to another doctor who would be hired by the insurance carrier to say, Dr. Newman's wrong. And then we would go into court and have to testify as to what was the basis of the diagnosis and dispel a lot of misinformation that was coming from the other side. And those were really distressing days. They were really hard on the individual workers who had to go through this. Here they were trying to deal with an illness that had been caused by their work, and they were being dragged through a courtroom process. Very distressing. If any of you have ever spent any time in a courtroom, you know how stressful that can be. But one of the most striking moments for me was in a deposition being asked by an attorney, well, Dr. Newman, isn't it true that only about up to 10% of workers exposed to beryllium ever get beryllium disease? And I said, well, yes, that's true. And I won't tell you which company he was representing, but what he said was, well, wouldn't you say then that the company I represent is doing a pretty good job because 90% of the workers aren't getting this disease? 90% aren't getting it. I said, well, let me put it this way. Imagine that I'm starting a company, and I'd like you to come work for me. And I'm going to pay you well, but I feel like I should tell you that there's a 1 in 10 chance that by working for me, you're going to get an incurable lung disease. Would you please sign here, and you can start tomorrow? Well, that lawyer was furious, right? He wasn't about to sign onto a job that could cause him a 1 in 10 chance of an incurable lung disease.
Going back to how you diagnose chronic beryllium disease, I have the sense that has changed over time. I'm familiar with the lavage. Does that still happen? Maybe you want to explain what that is and then tell us what it is.
Sure. So in the early days, to diagnose beryllium disease, we had to come up with some rock-solid ways of proving whether somebody really had that disease or not. Because if you go back to my story about Willie, his disease was being mistaken for another disease. So we needed to have criteria. We needed to have really good tests. And the tests that we used included a fairly invasive test called a bronchoscopy, where we numb up your nose and your throat, we give you some medicine to relax you, and then we put a tube in your nose and down into your lung. And in there, we do what's called a lavage. We wash a little section of lung to get the cells out of the lung, and then we can test those cells for whether they have that fingerprint reaction, whether those immune cells react to beryllium. So we were doing a fair number of fairly invasive tests to absolutely prove that people had beryllium disease or that they didn't. Over time, with medical advances, we've gotten better at finding ways to not have to do so many of those tests, because that's a fairly invasive test. It's done as an outpatient, but it's still, it's an uncomfortable thing to go through. So with the development of CAT scans, we got a lot of experience in identifying what does beryllium disease look like on a CAT scan. So even though it comes with some radiation exposure from having the CAT scan, it's less invasive than doing a bronchoscopy. We still do bronchoscopies today with lavage, not as many as we used to. As we've gained more information, and even for the Department of Labor program, we've helped set criteria where you don't absolutely have to put everybody through an invasive lung test to make that diagnosis. So we're not doing as many of those tests as we used to. I should mention that the other thing that we did in the early days was we were enrolling people in research studies. They knew it, they were consenting to it, and in fact some of my heroes are the workers from Rocky Flats who were those beryllium machinists who agreed to go through repeated bronchoscopies just to advance medical science, just so that we would know better how to treat and how to diagnose that condition. And there were some of the workers from Rocky Flats who went through 4, 5, 6 bronchoscopies every year or every 2 years for research, just in order to help us get answers to questions for the future workers. And that led us to the point where we could start backing off on doing so many of those kinds of tests and start relying on the blood test, which is not perfect, but we've made it as good as we can get it probably. So rely on the blood test and rely on chest x-rays, CAT scans, and breathing tests, things that are a little bit easier to do on people's bodies.
So do you know, does the Department of Labor accept that then as the evidence that someone deserves compensation because of CBD?
Yes, it's not as airtight if you don't have a lavage, but you can get compensated without having a lavage test done. And Terrie, you can probably corroborate if I'm right on that.
Yeah, the lung lavage is only one of the criteria set out by the legislation. And again, this is complicated. If someone was diagnosed with chronic beryllium disease before 1993, Congress set forth this 5 criteria, 3 out of the 5 that the claimant must meet. And it includes pulmonary function test, lung x-rays, the blood work, lavage, biopsies. Post-1993, the criteria is a positive, and I believe it's just one positive LPT result, the blood test that Dr. Newman was talking about, and then another one of the 5 criteria. The lung lavage is only one of the criteria. There is lung x-rays, CAT scans, pulmonary function test. What I've been hearing from the advocates and authorized representatives is that the Department of Labor is actually requiring a lung lavage, that fully invasive test, in order to be approved for chronic beryllium disease. That's what I've been hearing.
Yeah, I can't comment on whether that's true or not.
Okay.
But I can tell you that there are many people who I could diagnose today with chronic beryllium disease without having to take them through a lavage, because we've learned enough to know what other information can substitute for having the lavage done.
Well, Dr. Newman, I would like to invite you to maybe a meeting with the Department of Labor at some point in the future.
I'm sure they miss me.
Yeah. One of the things that I do is I'm a founding member of the Alliance of Nuclear Worker Advocacy Groups, And some of those members have formed a shadow board to the Department of Labor until Congress decides to create a board. And the lung lavage issue is one of our top priorities. We've gone to Department of Labor a couple of times over this issue. And
So this board would
the board would,
unofficially try to oversee what the Department of Labor.
we're a citizens board, yes, and it's purely volunteer. We're not funded. We do have a little cup out on our table for donations. But we have been monitoring Department of Labor's implementation of Part E and the lung Part B for a number of years. And they're always respectful. They always respond to our concerns. But to my knowledge, I don't think there's more than a handful of issues that we've brought to them as advocates that they've corrected. And the Presidential Advisory Board would make them respond and be accountable to their implementation of this program.
I'm going to invite, do we have our microphones ready for, yes, we do. Okay, I'm going to invite the audience to, if there's a question you would like to ask one of our experts, if there's something you'd like to bring up, please just raise your hand, and the kind folks will bring you a microphone. And keep in mind, we have, I know we're going to have a lot of people who want to ask questions, so the more direct, the better. Thanks.
Well, I don't know how direct this is. I'm Don Basso, a former Rocky Flats worker. I started in 1956 through 1991. I've been to the National Jewish Hospital for your testing and consider it a top-notch facility. I'm very impressed by your doctors and procedures. I've handled plutonium, americium, uranium depleted, uranium enriched, americium, neptunium, curium in the wet chemistry areas of the plant. I have a plutonium lung exposure that I got 47 years ago, and so that's kind of my background. I've always been interested in Rocky Flats health, so I've done cursory reading, asked questions, and so I have two questions. There was a report done in 2003, and this was sponsored by Colorado Health Sciences Center, Colorado Department of Health, NIOSH, and the summary of that report, and this was some 16,303 Rocky Flats workers. The summary of that report, the research showed that in comparison with death rates for the general public, the death rates for Rocky Flats workers were lower for all causes and for cancer. There's another report by Dr. George Volz of Los Alamos of the 26th most contaminated plutonium workers in the Manhattan Project. So this was a 50-year study. And over those 50 years, there were expected 16 deaths of these 26 workers. There were, I think, seven deaths, 16 expected, and no elevated cancer. So anyway, relating to those statistics, how do you respond to that?
Yeah, you want me to take that?
Yes, please.
Okay. Yeah, thank you for those questions. The first study, there probably is an explanation for why the death rates, the mortality rates, were lower for the Rocky Flats workers than the general population. And it's something that in epidemiology and research we refer to as the healthy worker effect. If you weren't fit, or if you had a health condition that might be aggravated by your job, you probably had a tendency to quit that job. And so the people who remained on the job tended over time to probably be healthier and fitter than the general population of Colorado. So it basically, we know this happens in a lot of industries, the healthiest workers stay in hazardous jobs, and people who are unhealthy workers who may be getting problems related to their job will leave those jobs. And so when you do a study where you examine the health of the people who are working at a plant, you're missing the people who quit the job. So that's one of the explanations, potential explanations for that finding. The George Volz study was a study of, they took the group of workers at Los Alamos who had the highest body burdens, in particular lung burdens, of plutonium. And they followed them, as you said, for over 50 years. That was what we call a descriptive study. They basically just brought them back and just sort of checked on their health every couple of years and wrote a paper every 5 years on them. We took a somewhat different approach. I had a Rocky Flats worker who we had screened him, and at the time I think it was Dr. Joe Furman was the medical director out at Rocky Flats at the time, has sent him in to see me, not because he looked like he had beryllium disease, his blood tests were all normal, but he had a terrible looking chest x-ray, and he sent him in to see me, and I did all the tests I could to figure out whether he had beryllium disease or not, and I thought I had taken a really thorough history of what he had been exposed to, and it was the last visit I had with him, and he said, I said, after all these tests, open lung biopsy, all these really invasive tests, I said, you've got this pattern of disease, but I don't know what caused it. And at that point he said, well, could it have something to do with that plutonium accident that I was in at Rocky Flats? Which he had neglected to tell me about, and I it's my fault that I didn't ask him. And I said to him, well, I don't know. I don't know. Let me go look. And I started looking in the scientific literature, and all I could find about plutonium and people developing scarring lung disease was this case series from Los Alamos. So we said that we would do a proper study, and with the help of Joe Furman and Bill Stange and the folks out at Rocky Flats, we designed and executed a scientifically rigorous study. We got funding from the National Institutes of Health, the NIH, to do a rigorous study. And what we found was, when we looked at all of those of you who ever had your counts done, we basically took all the count data. So we probably have somewhere in the database your numbers, and then we compared it to the X-rays that were taken on people year after year after year. We had radiologists read those X-rays not knowing anything about anyone's plutonium exposure, and we had control groups of people with no exposure. And in the end, what we concluded was that regardless of what the Los Alamos study showed, there was a statistically significant increased risk of developing a scarring lung disease if you had plutonium inhalational exposure. And it had to be, I forget the numbers now, what the cutoff was. I want to say like 1,500 rem. I can't remember to the lung, but I can't remember the exact numbers. It's in the paper. So I've come to frankly discount the case series study that you talked about, and I tend to rely on the more rigorous science, which says if you had enough plutonium in your lung, you're going to get a scarring lung disease.
Thank you for that question, Don. This is one of the frustrating things about the questions about health and workers. You used the example, Dr. Newman, if you stick your hand in a saw, everyone is going to be injured by that. There's nothing genetically protective or genetically susceptible related to that. Your fingers are coming off if you stick them in the saw, but that's not the case with these kinds of exposures. There are issues of genetically protective or genetically susceptible issues. Next, please.
Hi, my name is Judy Padilla, and I would like to ask this question to my friend Terrie Barrie. Since we're having this symposium on the 25th anniversary of the 1989 raid, what are the chances of extending the SEC, the Special Exposure Cohort, from 1983 to 1989? And the second part of the question is, if a person is granted compensation for Part E, could they also be granted Part B if the SEC is extended?
Okay, thank you, Judy. Yes, this is the SEC. For those of you who don't know, stands for Special Exposure Cohort, And that means if a person from Rocky Flats worked at the site for 250 days and has one of the 22 specified cancers that's in the legislation, they don't have to go through a dose reconstruction, and they're automatically compensated financially and medically. Right now, the SEC, like Judy said, mentioned, ends in December 31st, 1983. We are working, and NIOSH is working on their investigation. They have done some additional classified interviews earlier this year. They issued 2 white papers just Thursday or Friday, I think, concerning tritium exposure and something else, not record falsa. Oh, it's about it was about one of the studies that mentioned that they didn't have accurate records, and I'll be happy to share that with you. And so there is going to be another work group meeting, but I'm happy to say that NIOSH didn't, or the NIOSH advisory board did not push this off yet. They are actively working on it, and I will let you know. And I would love to see it through the end of 2005, but it's a process. And as a co-petitioner, we need to supply evidence and documents to show that NIOSH cannot reconstruct dose. And we have to a degree, and that's why we have it to the end of 1983. But for any of you workers who have documents that show that record falsification, or they didn't monitor for neptunium, U-233, uranium-233, and thorium, or tritium, please let me know, and we could use that to argue that NIOSH can't reconstruct dose. Thank you, Judy.
I have 2 questions also. I would like to know if bladder cancer has anything to do with kidney cancer, and also I would like to know if a spouse can be affected from the work that's done by the worker at Rocky Flats.
So the first question was bladder cancer and its relation to kidney cancer. Did I hear you right? I'm not an expert in that. Generally, the bladder cancers are separate from kidney cancers, and there are some, I'd have to go back and look, but there are some shared causes. So if somebody had both kidney cancer and bladder cancer, some of the solvents, I think, are on the list for both. And there are some, I don't know if they were used at Rocky Flats, they could be on that 19-page list, but there are certain dyes that are associated with development of bladder cancer. I don't know if those also can cause kidney cancer. So it's something that I probably should just say, I don't know for sure, but there are places where that can be looked up. And I'm reasonably confident there are some exposures that can cause both. One does not necessarily lead to the other, though. Bladder cancer does not put you at risk for kidney cancer. Kidney cancer does not put you at risk for bladder cancer.
And then what about the spouse? Can spouses be affected from exposures that their worker spouse received?
Yeah, it's a great question, and the short answer is we don't know. There's reason to believe that spouses could be affected, and I'll give you an example, but it's not from Rocky Flats. There was a beryllium manufacturing plant in Ohio where the worker did not get beryllium disease, but his spouse did, and she had never worked in the plant. He was carrying home beryllium exposure, beryllium dust on his clothing. He actually had been in a couple of industrial accidents where she ended up picking him up at the emergency room with his dusty clothes, and she ended up developing a truly terrible, terrible case of beryllium disease. And She was my patient for many years until she died of it, and she had never worked in a beryllium facility. Could the same thing have happened at Rocky Flats? Yes. Has there ever been a study of that to prove it? No. How could you find out? Specifically for beryllium, you could find out by doing the beryllium lymphocyte proliferation test. If you could find a doctor who would, do that test, and it wouldn't be covered under any of the programs, because none of these programs apply to family members. So you'd have to probably pay out of pocket to even get the test done. So that's one of the challenges. By the way, beryllium's not the only thing that can do that. We know that the same thing happens with asbestos. If people carry asbestos home on their clothes from work, it's well documented that family members can develop lung cancer, mesothelioma, even asbestosis, scarring of the lungs. Again, that's never been, to my knowledge, demonstrated for Rocky Flats, but it's something that those of us in occupational medicine know definitely happens.
None of those would be covered. Correct.
They would not be covered. That's correct. It would not be covered because if you didn't work there, then the rules around workers' compensation, whether it's a federal law or a state law, would not apply.
Someone down here and someone, oh, go ahead.
I would like to relate to the question of the level of beryllium compounds in the air. I'm quite familiar with beryllium oxide and berylliosis, and I'm tested every 2 years for berylliosis. Happily, I'm okay so far. The point I'd like to make is that there are some cases where exposure to massive amounts of beryllia have not resulted in berylliosis, specifically in that Elmore, Ohio plant that you mentioned, and I can mention several others. On the other hand, I've seen individuals get berylliosis as a result of working in a facility that by any standards would be regarded as really, really clean. Mm-hmm. And I guess what it amounts to is that for some people, you're going to get berylliosis or you're going to get cancer or whatever it is from exposure to really low levels. And for that reason, I think the idea of opening up Rocky Flats for recreational use has got some real big question marks associated with it.
Yeah, you raise a really important question. The last part of it, which everyone applauded for, is the part that I probably know the least about, because I cannot tell you today how much beryllium you would come in contact with if you were in the Rocky Flats area as a recreation area. I just don't know what the data would be. But what you said is absolutely right, that seemingly trivial levels of exposure, can cause significant, clinically significant beryllium disease. So that part we do know. And we do know that there is a genetic component. This has been very well studied. We know that there is a particular variation of a gene that about 45% of us have. We're just born with it. It's not a mutation. We're just born with a variation of a gene that, if we're exposed to beryllium, makes us more susceptible to it than other people. But that's about half of us here are just born with that gene. So we do know that susceptibility to this is genetically related, but we also know that and in those people in particular, just very, very low amounts of exposure can be devastating. Think about the woman I mentioned who was the spouse. She didn't work every day in beryllium. Her husband was a beryllium furnace operator, and the thing blew up, literally with him there at a furnace. He was bathing in beryllium at that moment, and he never got the disease. So that just calls out your point. I think that what people would need to know is how much beryllium is in the soil, how much of it could be pushed back into the air, and is that any different than the amount of beryllium that we have in the general atmosphere? We do know that there's beryllium in the coal that we burn. In Colorado, anywhere, there's a certain amount of beryllium that gets into the atmosphere. There's a background level of beryllium. So we'd probably need a little bit more exposure assessment in order to know whether your concern about community exposures is going to be significant or not. And so I would say that's where we just need more information.
Okay, we have someone here and then there.
Yeah, I have a related question. Many of the people who live or lived in this area or grew up near Rocky Flats have some of the illnesses. They share some of the illnesses that the workers have. And this goes back for quite some time and is certainly true to the present day. There never has been any public health monitoring for people who live around Rocky Flats. And I'm wondering how we can move forward with this issue when we have so many people who are sick, family members, children, and also people who just grew up here or who live here. And I include animals in this category as well because we see a higher rate of cancer in dogs. For example, veterinarians report a higher rate of cancer in dogs. So how can we expand this issue? The workers are very, very important, obviously, but we also have a greater public health issue, and how can we move forward with that? Do you have any suggestions?
Well, you
I
two are
thought
thinking
Dr.
about that. Because
first
this
of
is a. Oh,
yeah.
go ahead. You have
Well,
something?
Well, I'll start by telling you I've never studied it, and so I can't really speak to the community health impact. I can tell you from a public health standpoint, the starting point for that, our main remedy is through our county and state health departments. Now, some of you may have gone there and may feel that you've gotten answers or not gotten answers. I can't speak to that. But that is the process that we as citizens go through if we have a concern around our health in the community. That's not work-related, is taking it back to county and state health.
Did you want to add
And what
something?
I would, there's a group, I think it's called Candleless Grows right now. I think
Say that again, Terry.
Candleless Glows.
Candleless glows.
Glows.
Candleless glows.
Is that right?
Oh, Candelas
yeah. It's
glows.
yeah.
Okay, thank you.
The one with
Candelas
the red
glows.
horse out. They've been quite vocal about their concerns about the new development out there. And if there's a tendency for the local, county, and state health departments to brush this concern off, I would suggest doing something a little bit more formalized and getting petitions together to say, hey, take a look at this. Take a look at this scientifically and make it official. Attend the committee meetings, attend the commissioners' meetings, and make your voices known if there's a big concern about this.
I would just add something very briefly, and then we'll have time for one more. This is a question that I encountered over and over again in years writing about nuclear weapons facilities around the country. And what I heard from folks over and over again, that the difficulty in, we've just spent more than an hour hearing about the difficulty when some of the exposures are known and there's a very clear fingerprint about them. One of the greatest challenges in answering the question about health for off-site public is we don't have any data that talk about what the exposures are, and we don't have really very good data talking about what the diseases are. So there's, not only is it difficult to connect those two, there aren't good data on either side. So it's that's kind of where you start with that.
That's contested. What you just said is contested.
Okay, they're saying that's contested, so there are data. Okay, this will be a whole nother, we'll have to come back and have a whole nother panel on this. Okay, you're next.
Yes, you said you don't like to quote statistics, but your 10% of the people get beryllium brought something to mind, and that is, I think my image is that everybody who ever worked at Rocky Flats has some sort of medical condition that resulted from their exposure there. But that's probably not true. So what is the percentage? What is the number? How many cases are we talking about that would need to be resolved?
Yeah, just putting a rough percentage on it, because I really don't have the numbers in front of me, and I wish I were encyclopedic, but I'm not. Roughly about 40 to 50%, about 1 in 2 of the workers who we have screened, let's just use the information from the NSSP, the National Supplemental Screening Program. Nearly 1 in 2 has a health condition that is possibly related to their work. Now, not all of those will be confirmed as being work-related, but it's running about 1 in 2. And in some parts of the site, certain jobs, it's probably even higher than that. But that's including, having 1 or more health conditions. So somebody could have noise-induced hearing loss. They could also have beryllium disease. They could also have, a brain cancer. I mean, there are different combinations that people can have. So it's nearly 1 in 2. And I might add that we're finding a very high rate of people who have other health conditions that are not related to work at Rocky Flats, where we're able to give them information about those other health conditions and refer them back to their doctors. So we're uncovering people who have high blood pressure, who never knew they had high blood pressure, and some of the things that we can learn from screening.
I'm going to look to the coordinator. We're at 2:30, which is our ending time. Should we take a few more questions because we have several people with their hands up? Okay, who has the microphone?
Yes, I am Ted Ziegler, and
Hi, Ted.
very good friend of Lee. And I worked at Rocky Flats, hired in as a machinist, journeyman machinist. I worked in the beryllium machining, and shortly after I hired in, I became representative for the beryllium health effects with Mr. I.K. Roberts. Excuse me. I have a lung burden myself, and I'd like to kind of focus on something that was brought up here. People that could be contaminated and not working at Rocky Flats. I have, after I hired in and became a safety representative, I obtained a picture that has 12 different violations on the beryllium machinists in building 444. And the picture is taken right in the beryllium machining area. None of the workers had the ability to wear a respirator. I would say about half of them. And they had full beards. There were 12 violations in that picture. They ate a 12-foot sub sandwich that they were all holding. There was a Christmas tree. It was a celebration on Christmas. Christmas tree in back of the group. All of the ornaments went home. The supervisors wore their street clothes with a smock on it. And about 1984, I believe it was about 1984, I started to focus quite extensively on the beryllium issues. Worked in conjunction with Lee at National Jewish, and commend him for his contribution. I'm very concerned right now about the Candelas construction at the buffer zone. There will be children out there. There will be gardens out there. I talked with an individual that had his lawn in. He was told it was safe out at the buffer zone. They intend to have a hospital out there, from what one of the sales reps told me. They intend to have on the south end a shopping center, and it's going to be another city down there if they develop that remaining portion. 64, close to 6,500 acres, I believe, was the environmental concern. They reduced it to 1,300 acres for the Rocky Flats area that you cannot have access to get on that property. Now, children in the future, if they're curious about what's on the other side of the fence, they'll be down there. There'll be gardens out there. I'm very concerned about the cancer issues too. Plutonium. Now, there's a satellite picture that I have that shows quite an area out there, and it shows the plutonium that is in the ground out at Rocky Flats. It also shows spots of plutonium that go on other areas that are not even on the buffer zone. And I believe if there is a full development at the Candelas construction, there's going to be a future generation in the same position that you see out at Rocky Flats at this time on exposures and health effects. But I'll make a statement here. It's nice to see all of you people here that are concerned.
Thank you. Okay, there's one more, two more. Jake is getting his exercise today.
Thank you. Hello, my name is Stephanie Carroll, and I specialize in chronic beryllium disease, and I'm an authorized rep for workers across the country, mainly Rocky Flats. And first, I just wanted to thank you, Dr. Newman, for educating Congress on the dangers of beryllium and your many years of dedication to the Rocky Flats workers.
Thank you.
I've been very successful in getting compensation for workers for chronic beryllium disease. Although in the last 7 years, it's been very difficult to get anyone diagnosed with chronic beryllium disease. I have workers that have been arguing their claims for up to 10 years that are beryllium sensitized, have positive obstruction on PFTs, have positive nodules on a CT scan, have positive B reads, have lymphocytosis on a lavage, and no granulomas found on a biopsy. They are not diagnosed with chronic beryllium disease. They are brought in again and again into National Jewish, and I know that you are not with them anymore. And it seems like since about the time you left, no one is getting diagnosed with chronic beryllium disease, and they are continuously getting very extensive testing done. And no matter what the test reads, they are not getting a diagnosis of lung disease. And I noticed in Econometrica, Department of Labor didn't accept the exhibits that you put in for beryllium sensitization, which read, you cannot be beryllium sensitized if you have lung disease, along with being sensitized. So if you're sensitized and have lung disease, you've got chronic beryllium disease. You've had years of exposure. I'm very frustrated with that. I've noticed that a lot of the researchers don't want to talk to authorized reps who have enormous amounts of data. We have not just site data, we have personal physician data, and we also have exposure data. And we would love to share that with the researchers if we could see First of all, if research is being done, that there is a goal of finding a new treatment for the disease, and that I think finding a new treatment would be great, because in all these years of studying workers, we haven't found anything besides prednisone. So I'd like to see workers diagnosed earlier, which was your goal when you started this, so that a treatment may have some significant effect on their outcome. So first of all, I would love to be able to share information with you. And I know a lot of other authorized reps would also. But the main question is are you following up workers? Can they come to see you? Can you suggest someone else they can see if they haven't been diagnosed after 3 or 4 lavages and biopsies?
Wow, that's a lot of questions. And I want to thank you for your efforts on behalf of the injured workers. It's really important that we have people like you out there working in the community. I'm married to a very wise woman, and my wife, Dr. Lori Schakowsky, said that when I decided to leave National Jewish and go over to the university to help start the Colorado School of Public Health and spend my time as an educator, that I couldn't keep doing everything that I was doing as well. And I made one of the hardest decisions of my own career, which was the decision to stop seeing patients. So in 2006, I stopped my clinical practice. So the short answer to your question is no, I'm not seeing patients at this time. And I probably won't. It's now been since 2005 that I left National Jewish to help found the Colorado School of Public Health. As far as the data side of it, maybe we can talk afterwards. There's some challenges some hurdles that we'd have to overcome to be allowed to see clinical data. Even if you have it, sharing it with me is something that would have to go through a very rigorous process of making sure that it's done in a way that protects people's personal health information and they know that that information is being shared with researchers. So just to know there's a process for doing that if we were going to do that, and talk to me afterwards about that possibility. Although I'm no longer in National Jewish, I do have to say that I know those doctors. I trained many of those doctors, and I have the utmost respect for them, and I can tell you that you will not find physicians who are more committed than they are to getting the right answers for Rocky Flats former workers, or any workers for that matter. This is a group that if when push comes to shove, they have workers in their hearts. And you can't say that for every doctor. That being said, I can't tell you about what the practices are that are going on there today. The last thing I'll say about your comments is that it's disappointing to me that the Department of Labor is ignoring criteria. If that's the case, that they're ignoring the criteria that you just laid out, those were criteria that were made pretty clear to them in the legislation. I did work with staffers who were writing that legislation back in the 90s, and we understood then that there needed to be, some, if you will, some room to accept cases that didn't fit every single criteria. So that to me requires a political and administrative fix.
I have gotten the signal that we have to wrap it up in this room so they can get it ready for the next panel, which is what do we know about contamination from Rocky Flats 25 years later. But we can continue talking. There's a discussion center, an information center, and I invite you also to take some time to look at the exhibition, which is downstairs. So thank you all very much for coming, and I appreciate your participation.